So I'd like to just start with some basics. At what age do we consider horses to be geriatrics? 1 horse year is approximately 3 human years. So if any of you have a 30-year-old horse, you can do the math, and he's about a 90-year-old horse. Old is anything older than 20 years, so 20 to 29 is considered old, and then very old is greater than 30. About 20 to 30% of the population is greater than 20 years old. We do see horses, well, there have been horses. I've only seen 1 horse that passed, well, two that made it into their 40s. The world's oldest horse, I believe, passed away at 51. So that's getting up there. 30s are pretty common these days. So why do we treat geriatric horses? So as I mentioned, 20 to 30% of the population is over the age of 20. So a lot of our patients are geriatrics, so they're living longer. That population is growing. And I think that can be attributed to genetics, as well as better nutrition and better forms of nutrition, a better understanding of how we need to change the way we're feeding them to keep them going, beyond the lifetime of their teeth. And then other advances in veterinary medicine that allow us to take better care of them. Their bond with the people that own them is more like a companion animal these days than it is a livestock animal. They oftentimes remain with the same owner for 13 years or more, and that a lot of them are still performing well into their geriatric years. So their job may have changed. They have a new career. This is the world's oldest horse. I don't know how old he was in this picture. It was paired up with saying that he was 51, but I have a hard time believing that's a 51-year-old horse. This guy is another one that we raised and was able to show him and retired him, and we tried to give him a retired career because he was a pretty good 5-gaited horse, and he absolutely hated it. He wanted to stay inside and be useful, so he started out being an advanced lesson horse, and then he was an intermediate lesson horse, and then he was a beginner lesson horse, and then he was a lead line horse, and then he was the horse that little tiny kids could pet before he passed away at 30. So anyway, so some of the changes that we see in the appearance of geriatric patients include graying of their hair coat, loss of muscling along their top line and elsewhere, so they develop some of them, not all of them, but some of them will develop a swayback or pot-bellied look to them. They have more prominent bones around their eyes as some of their facial muscles start to atrophy. There can be changes in their hair coat or shedding pattern, loss of stamina, either due to changes in cardiac or muscle function or lung function, and then dental changes. So some of these are normal aging versus developing medical conditions. So the trick on our part, as well as yours as horse owners, is to try and identify what's, we don't worry too much about gray hair. Some of us don't worry about gray hair. But we should worry about maybe loss of stamina or dental changes and things like that might be an indicator that there's something else going on that we need to pay more attention to. So they commonly have problems in their digestive tract. 3 things that kind of add up to problems with weight loss are their digestive tract over time becomes a little less efficient. They're not digesting food as well as they used to. They're maybe not absorbing nutrients quite as well as things used to work. Parasite issues, parasite exposure from years ago might start to crop up as an issue now. Plus, as their immune system kind of weakens, they may become more susceptible to parasites. Dental abnormalities or tooth loss or decay can all contribute to weight loss. Their bones and joints become less resilient to trauma and injuries. And arthritis, just from wear and tear, becomes a lot more common. And these two equal chronic pain management possibly. Respiratory concerns may crop up. COPD or HEAVs becomes more common. They're less able to cope with environmental stresses. They tend to overheat a little faster than a younger horse does. And part of that has to do with lung function and cardiac function that changes just with age, not necessarily with conditioning. And then there's hormonal changes that can affect a whole myriad of things, with the most common one we see being Cushing syndrome, which we'll touch on a little bit later. So what I would like to do with the next section of this lecture is just touch base on all of these topics. These all individually could be an hour-long lecture. We're going to do it in a couple of slides for most of them. So feel free to ask questions. We'll spend a little bit more time on PPID or Cushing's. And what I tried to do is highlight some recent publications or papers that were published recently that have a little bit of new information that might be useful. But keep in mind, old age is not a disease. As I get older, I try to keep remembering that, even though things fall apart. But anyway, so colic. How many of you have had a horse that colicked? Had an old horse colic? Yeah, it happens. It can happen in any age horse. In older patients, in any horse, large colon impactions are pretty common, but they're one of the more common types that we see in a geriatric horse. And a lot of that can be related to their dentition or not drinking enough, or probably both. So if they're not chewing their food well and they're still on long stem hay, that long stem fiber is getting to their colon while it's still long rather than nice and short like it used to, and it tends to plug things up a little more easily. Another one that's very common and that we always worry about, it always makes me shudder when I get a call saying their 30-year-old horse is colicking and he's really bad. Our most common surgical colic in old horses is a strangulating small intestinal obstruction, with 44% of them being lipomas, which are a tumor of the mesentery in their abdomen. And those require surgery in order for the horse to survive. So whether we manage them medically or surgically is it's in part up to you guys, as well as what the lesion is. If it's an impaction, we can manage the vast majority of them on the farm with a stomach tube and lots of water and electrolytes and maybe a few laxatives and some pain management. And the vast majority of horses, I think over the years, I've maybe sent 2 impactions to surgery that I know of. But all of whenever we run across an aged horse that I can palpate small intestine on our initial exam, the next words out of my mouth are you willing to do surgery on this horse, or can we send it in for further observation, or because I think he's going to need surgery if we're going to keep him going. So the next question is, should you do surgery on an aged horse? There was some work done that was presented at the Equine Practitioners Association meeting in 2013 that showed that aged horses had a similar complication rate to younger horses following surgery for similar lesions, and that the survival rate was similar between an older population of horse and a younger population of horse, given that their health status is essentially the same and the lesion was the same. So that being said, if you have an older horse that's suffering from chronic laminitis, or we've run out of teeth and we just can't keep any weight on him at all, and he colics, that's a different discussion than that horse that they said was 51. A horse that looked that good, that didn't have Cushing's and didn't have any other issues, would probably be a better candidate than the one with chronic laminitis and can't keep any weight on. So they do seem to be more likely to need surgery due to the nature of their lesions. And the other thing that we have going against us sometimes is that they can be extremely stoic. We've had older horses that have a lipoma that's wrapped around a large section of their small intestine, and in a younger horse that usually causes a lot of pain. They're throwing themselves on the ground and really being demonstrative. Sometimes we'll run across an older horse that's just standing there looking depressed, and that tends to delay you calling us, and then it may delay us referring them in because they just don't look too bad, or they don't look too bad and we still can't palpate small intestine that gives us a heads up that something more serious is going on. So in these older guys, when everything's just not adding up, I tend to reach for my ultrasound to ultrasound their belly, because sometimes even if I can't feel the small intestine, I can find it with an ultrasound. So if we're asking you to ultrasound, please let us do it, because it's not just to spend more of your money, it's to try and make sure we're getting the right diagnosis instead of sitting on something that should probably be headed to a hospital. So another thing I'd like to mention is you should spend a little time thinking about your older guys and decide ahead of time whether or not you think you would do surgery. Surgery tends to run anywhere from $3,000 to $8,000. Small intestinal lesions tend to be at the higher end of that estimate, just because the surgery tends to take longer, and if they need to do resection or remove part of the small intestine, the bill will be higher. So just give that some thought before you're in that position. Yes. All right. So we'll just move on to dental care. So horses' teeth tend to continually erupt into their 20s, aside from their incisors and canines. As they continue to erupt, they run out of root eventually, or they run out of crown. And the tooth, when they're young, their tooth may be this long, and that molar a lot of that reserve crown is buried in their jaw. That'll wear off, and it just keeps coming up until finally they just have a little bit of root left and a tiny bit of crown, and then that tooth either breaks up and we pull it, or gets loose and we pull it, or it just falls out on its own. And they start to develop a wave formation, which is 2 or 3 teeth that are, it's just like it sounds. It looks like this if you look at them from the side of their mouth. Or a step is where they've just lost one tooth and the opposing tooth over erupts to try and, because they'll just keep coming up. The bottom will come up to meet the top. So if one is missing, the opposing tooth just continues to come up to meet the gum on the other side. So that becomes a step. Or there's a smooth mouth is where the surface of the tooth starts to hollow out because the structure of the tooth at that level is softer than it used to be, and it just wears away faster. All of those things make it harder for them to grind food. It kind of locks their jaw up, and it just doesn't work the way it should. As they continue to erupt, the crowns get narrower, so the teeth start to have little separations in between them that allow food to pack down in between them and leads to periodontal disease that then leads to tooth loss, just like it does in us. And then now they've lost some teeth, or their teeth just aren't functioning the way they should, and they can't chew very well, so they're trying to swallow long stem hay that is still long stem hay. It's not chewed up, and they are predisposed to choke. But yes. But our point is that dental care needs to start early in life, because if we see horses when their teeth look like this, which we're a little bit limited on what we can do versus an arcade, ignore this big hook here, versus an arcade that looks a little more like that. So if we're seeing this horse, and this is the first time it's at a dental, and we're at 25, this is what the horse is chewing with. So if I try and flatten this out, keep in mind they're not erupting very much anymore. So if I take this big hook off, the bottom tooth may not be there anymore, but it may not come up anymore because it's not erupting anymore. So if I take that away and it was meeting something down here, then I've taken away grinding surface. So it's best if we can address these problems as they come up versus trying to fix them now. So if this is a 15-year-old horse or a 12-year-old, we can take that hook off, save the tooth that's being damaged down here, and keep the rest of these going the way they should, and try and keep this mouth from becoming this mouth. This is just an incisor that's got a root fragment here, and this tooth was loose. You can imagine that this horse might belong to that mouth, but this horse had a different issue. So anyway, so we do recommend a complete oral exam annually to semi-annually, depending on the history of your horse. We may start talking about radiographs at those visits a little more often than we did when your horse was younger, to try and assess root health, how much root we've got to work with, whether or not it looks like there's an abscess down there, that would help us determine a treatment plan. And extractions become more common. So this is just a novel finding. This was a routine exam. It was just a, hey doc, can you pull his tongue aside and take a look? And when I did, I thought at first that we had exposed maybe a tumor or some exposed part of the hard palate. Turned out, because this horse wasn't showing any clinical signs at all, wasn't salivating, wasn't chewing funny, wasn't nothing. This is actually a stick that's wedged, in between his upper teeth and was there long enough that when we pried it out of there, there were two little wounds on either side that were granulating in, and it takes at least 5 days for granulation tissue to develop, so that was there probably a week, with the horse not saying anything. So we really need to open their mouths and take a look, because they're not gonna give it away. So a condition that's gotten more press in the last decade is equine odontoclastic tooth resorption and hypercementosis. I never say that after a drink or two, but it affects the incisors of older horses. We're seeing more of it, I think in part because we're looking for it, and also because the population's getting older, so they're having more time to develop it. This is a great example of what incisors should look like. The gum line is nice and pink. It's flat. The tooth, the top of the crown comes to the same level on all of these. They're wearing at a pretty flat, straight across way. The gum comes well down between the teeth, and all the teeth are right next to each other. So this whole unit is acting like one tooth, essentially. The clinical signs that we see with this is typically weight loss, salivation, drooling. They're playing in their water bucket. They might be holding their lips open or grimacing or avoiding the bit, or some people will say, my horse is smiling at me. Isn't that cute? Or they just quit eating apples. They won't take carrots anymore. Or they used to like these hard treats, but now they don't. And then we open their mouth, and these are a couple extreme cases. Some of you have experience with this. So this is an incisor that has almost the entire root exposed. These are very short, again, almost the entire root exposed. And there's supposed to be 6 across here. And I think you can count at least 5. I think that's on the bottom, maybe a bottom canine. This horse we actually just saw this morning, and was the skinny horse in the last photo. So that's this horse. Supposed to be 22, but after I opened the mouth, I said I would add a few years to that. So this horse has 1, 2, 3, 4, 5 This tooth was broken off. This tooth was noticeably loose and really didn't like me touching that one. There's spaces in between all of them. You can wiggle all of them. The bottom teeth, there's 1, 2, 3. That was actually broke off. 5 here, so we're missing at least 2. There is some bulging here. So when we take, there's 2 forms to this disease. This is what they should look like on a radiograph. So the roots are nice and long and tapered, and there's a thin black line all the way around, which is the periodontal ligament that holds the tooth in place. That's what they should look like. The hypercementosis version of this disease looks like this, where they have a really large bulge of cementum on the root of the tooth. And in this horse, he has, this tooth looks relatively good, so does that one and that one, but this one is starting to bulge. So 3 affected out of 6. Same deal over here. It's just the opposite side of the mouth. And then this is a good example of the resorptive version of the condition. So this horse has a little bit of both. Has the hypercementosis version as well as the resorption of the root. And these teeth belong to this horse, which presented again for just a routine dental. The back teeth were in pretty good shape, but when we opened his lips, he had some bulges that corresponded to these teeth. And then over the top, the gum that overlied this tooth root had a pimple that was oozing some pus out of it. So this is a condition that we can work up in your barn, set up and take radiographs right there. Yes?
What's the cause?
The cause? We're going to get to that. What risk factors are. We're still working on a cause. And if we don't know a cause, then the treatment gets a little trickier. But anyway, so we can work it up in the barn. If they're very loose, we can pull them in the barn. Most of these we're still referring in to the university or various other places that can remove the affected teeth. But the horses do typically quite well afterwards. They tend to, we have a little bit of trouble determining how much pain these are causing them because it's not an area that we can block and then say, okay, now go eat normally. Because they usually have, like you would a lameness, because they usually have some other issues with their back teeth. So we're removing them on the assumption that the weight loss that we're seeing is associated with these teeth. But I can tell you that after having had several horses have teeth removed, whatever behavior they were doing beforehand has stopped and they gain weight dramatically. The first horse that I sent, they removed all of his upper incisors, and that horse gained 60 pounds in the first month. Yeah. Anyway, some of the risk factors, there was a paper presented a couple years ago that looked at risk factors for this. And the ones that they came up with were excessive dentistry that involved the incisors. So if there had been a lot of work done on incisors, which most of us have gotten away from incisor work because we've learned more about what you should and should not do, or trauma of any kind. So I think cribbers are a little more prone to this. Or horses that want to bite on stuff constantly because they're traumatizing those teeth. Periodontal disease, if they're not chewing very much because their teeth hurt, they have less saliva being produced, and that saliva bathes their mouth and cleans things up. If they're being fed foods that don't require a lot of chewing, they're not creating as much saliva. So horses that aren't allowed to graze or are being fed more concentrates or hays that are easier to chew, like second or third crop alfalfa that may not require as much chewing as a more fibrous grass. And then their head position. It's still best to feed them off the ground because that's the way God intended them to eat, because that allows more saliva bathing of their mouth. And then any systemic condition that causes systemic inflammation was a predisposing factor for this condition as well. So a lot of the things we see in old horses. So Cushing's, metabolic syndrome. Metabolic syndrome is a predisposing factor for Cushing's, and then Laminitis as well. And unfortunately, we don't have a direct cause for this, so we don't have a direct treatment. There's been various treatments tried, prolonged antibiotics or steroid injections into the area. None of them have proven very effective. So right now we're at a phase where we monitor and remove teeth that we think are causing pain. So we'll change gears a little bit and go into Cushing's. So anybody have a horse with Cushing's? No? Oh, that's pretty good.
Can I ask a question about
Yeah.
the last
Yeah.
one?
Yeah.
So when they pull their teeth for sedation, do they just sedate them so they're still standing up, or do they knock them out completely?
To remove incisors, they can be done standing with sedation and then nerve blocks. We can block the nerves that feed those teeth, just like they would for you. It is nice to have a set of stocks when you're doing that, because these are old horses that may have arthritis, and they may be thin anyway and not able to tolerate sedation real easily. And you never know when you're going into this how long it's going to take. Some of them are sedated for just a short period of time, and others are sedated for hours. So it's nice if they've got a set of stocks that they can lean on while it's being done. But all of the ones I've referred have been done standing.
And is that pretty much the treatment? It's pulling?
Yep, unfortunately. Yep. When they are pulled, you might be concerned that they can't graze normally after that. They graze even without those teeth there, whether they have some removed or all of them removed, upper and lower, they graze just fine. The one thing that does happen if they have all of them removed is that their tongue will hang out of their mouth, which some people find that a little bothersome. But when the horse is resting, and I have pictures. I can't find it. I'd like to include it, but a horse is resting, their tongue just dangling out of their mouth. But when they're alert and working, if you were trying to show them and you didn't want their tongue sticking out, most of them are alert enough that they would be holding it in their mouth at that point. So, equine Cushing syndrome, by far and away the most common endocrine or hormonal issue that we see in older horses. Average age is 20, but the range is anywhere from 7 to 42. We're finding more at younger ages because of some better testing that's available. About 21% of horses that are over the age of 15, and it goes up from there to 30% of horses over the age of 30. Some of the very common clinical signs, the most common one and the one that we used to always look for was the hair coat issues. So they fail to shed. They look like a hairy yak well into July. Those are the much more advanced cases typically. They may not shed the way they should, or they shed and they grow it right back very early, or they shed in a patchy fashion. Excessive drinking, urination, sweating, they're prone to laminitis and founder for no other, with no other cause associated with it. They may have delayed wound healing, chronic infections, parasitism may become an issue. All of those can be related to immune system issues. They may be under or overweight, blindness, seizures, inappropriate lactation or pseudo-lactation, diabetes or insulin resistance, some behavioral changes. Some of them become quite lethargic and mellow, which I think a lot of people might write it off as, well, he's just getting old. And then there are some reproductive problems that Dr. Griffin will touch on. Yeah.
How about fat deposits in the neck and stuff like that?
Yep. So inappropriate fat deposits, so that crusty neck over their rump. Some of those can be metabolic syndrome as well, which I'm not going to get into today. There was something else I was going to add. Yes?
What kind of blood test is that for the Cushing's?
It's coming up. So one of the things that we talked about was delayed wound healing, chronic infections, and parasitism. So those are related to immune system issues. Their immune system becomes suppressed. So there was a paper that was presented this year that talked about how these horses react to routine vaccines. There currently aren't any specific vaccination recommendations for horses with Cushing's, other than, continue doing it. So this was the first study that was done to try and determine if they truly had a difference in the way they react to vaccines. So what they did is they looked at the immune responses in two groups of age-matched horses, one group that was diagnosed with Cushing's and one that was not. And they were all tested, so the ones that didn't have it by our current testing standards. They were vaccinated with influenza, EHV1 or rhinopneumonitis, and West Nile virus. And what they saw was that there was no difference in the response to influenza. Both groups responded equally well to influenza vaccine, but there was a significantly lower response in the Cushing's horses to rhino and West Nile. So while they still didn't give us specific vaccination recommendations for Cushing's horses, but we get asked all the time if you really need to keep vaccinating them, because I've been vaccinating them for years. Surely they have some immunity by now. But West Nile is an issue that they don't need to be exposed to another horse. So even though your horse is not traveling anymore, it's just living alone at home, we probably do need to keep vaccinating them, because their response to the vaccine is not as good as it used to be. The same thing for rhino if they're in a community barn. Anyway, so the diagnosis, you were asking about the blood test. There's a series of blood tests that can be done. Are you guys familiar with what Cushing's disease is? Some of them? So it's due to a tumor that's developing at the base of their brain in their pituitary gland. To date, we don't have a treatment specifically for that tumor. You can't remove it. We don't have a way of shrinking it. What we can do is treat the side effects. And it's a slowly progressive growing tumor. So, they don't one day not have Cushing's and the next day they do. It starts to grow, and then it's subclinical for a very long time before it becomes clinical. So when we get it diagnosed is what we're after. The earlier the better, to try and keep them healthy as long as we can. There are some seasonal variations in the testing, in the compounds that we're looking at. So time of year starts to play into when we can test them and get reliable results. For advanced disease, so this horse likely has advanced Cushing's. We can diagnose it based on clinical signs alone. I mean, this hair coat, there's really no other cause for a hair coat like that, or in combination with testing. So maybe they have some mild hair coat changes, but they have other things going on. So you might go with just clinical symptoms alone or a combination with testing. In a horse like this, a low-dose dexamethasone suppression test would be a reliable test. This is a test that's done in 2 steps. We'd come out in the evening or late afternoon one day, pull a blood sample, give them a dose of dexamethasone, come back 19 hours later and pull a second blood sample, and then compare the levels of cortisol in those 2 samples. If we're trying to detect earlier disease, it can be a little more challenging. There's a couple different tests available. Tier 1 would be a resting ACTH level, and they have worked out seasonal normals for that, so we can run that test year-round. It's a one-step test. We can pull at any time of the day. There is some sample handling criteria that need to be followed. If the sample's not spun down within 4 hours and pulled off the red cells, then it can alter the blood level. So your veterinarian may be a little picky about what time of day we pull it, because if you're the first call of the day and I'm not going to be back to the clinic until 5, it's probably not the best day to pull that. But other than that, we can do it year-round on one visit. The TRH stimulation test, or thyrotropin releasing hormone test, is the most sensitive test that's available currently. Again, there's no fasting required for this test. It's a one-visit test because we pull a blood sample, give them 1 milligram of TRH IV, and then 10 minutes later pull a second sample. The same handling requirements apply to these samples because it's still an ACTH level as this one, so that's about the only area that we might get picky about it. They're still working on seasonal normals, but right now you can run it between November and July. The early fall months, you can run it, but if you get a negative result, the horse is truly negative. If you get a positive result, it may be a false positive because their ACTH levels go up in the fall, so it becomes a little more difficult to interpret the results. Other things that we might talk to you about would be insulin testing to look for insulin resistance. A significant portion of these horses are insulin resistant, so it's recommended that they be tested for that. These are fasting tests, so you need to take their hay away the night before or their feed away the night before after 10 o'clock. Don't give them anything until the following day and until we see them and get the blood samples out of them, and then you can feed them after that. But we used to do a fasting glucose and insulin, but that's been shown to be fairly inaccurate in helping us determine anything. The current test that's being recommended is an oral sugar test. So we would give you a couple syringes and a dose of corn syrup to give your horse. So you would fast them overnight, and then the following morning give them orally a dose of corn syrup, light corn syrup. And then we would show up an hour later and pull 2 blood samples a half hour apart and look at them for sugar and insulin levels. So as I mentioned, this isn't a tumor that we can remove. It's fully encased by bone sitting underneath their brain. It's about the least accessible spot you can imagine. So we just have medications that treat the side effects of the tumor. And the most effective one that's currently available is Pergolide, which is available as Presend tablets. It's 1 milligram or 1 tablet for a 1,000-pound horse. Since we've switched from all the compounded products to Presend, which is an FDA-approved product, we saw more horses that would go off their feed. About a third of the horses, when you first start it, might go off their feed as a result of these tablets. So the recommendation is to start at a low dose and build up to the 1 milligram, and that side effect tends to go away.
Can you give that in a powdered form?
You can dissolve the tablets. They're not recommending that you pound them out because then there's some risk of human exposure to them. The powdered form that I think you're referring to is one of the compounded products. Since Presend came on the market as an FDA-approved product, it's no longer legal for us to prescribe compounded products because there is an FDA-approved product that's labeled for horses. The other thing I will say about that is that when this came out and we started switching all of our horses to it, I had almost all of our owners said that their horses were doing better on Presend than they were on the compounded product. And there had been work done that showed that Pergolide's not stable in the powders and the liquids and the chews and all the compounded products. It was degrading in those formulations so that you were not actually giving a milligram of Pergolide anymore. So when we switched them all to Presend, and these are in bubble packs that have nitrous oxide, I think, in the little bubble to keep them stable, everybody said their horses did better. So we no longer have anybody on compounded products. Cyproheptadine was used years ago quite a bit because it was less expensive than Pergolide. Then there was a shift and it became more expensive than Pergolide, so we switched them all to Pergolide. Now really the only time I use cyproheptadine is if they're not responding to Pergolide and we've increased the dose and they're still not responding. Some of them will respond if you use both of them in combination. It's recommended that they be retested 30 days after you start the treatment once they're on the full dose, and then adjust their dosage if needed. So there was a paper presented that looked at the long-term response to Pergolide. It was a relatively small study of 30 horses that they looked at over 5 years. In that 5-year time, remember we're working with geriatric horses, 14 of them were euthanized for various reasons. 4 of them died. I can imagine the researchers going, am I going to be able to publish this paper? 12 of them stuck around. And what they saw was that there was clinical improvement, high owner satisfaction, and that in greater than 60% of the cases there was normalization of their blood tests. We don't expect them to completely normalize. What we would like to see is that they head towards normal. Some of the very advanced cases will never get back to normal, but we'd like to see them heading in that direction. So. The other side of treatment is management, so they should be on typically on a low-starch diet, hay-soaked to remove some of the sugars. That's more for Cushing's horses that are experiencing laminitis. So if we're having issues with laminitis, we're a little more concerned about what their diet is. If they're not experiencing laminitis or they've never had it or they're underweight, I'm much more free to feed alfalfa as needed for weight. You might need to body clip them because if they won't shed their hair and it's July, and then just excellent preventative health care. So we're going to move on to laminitis. In older horses, this is usually associated with Cushing's, or we're at least looking for Cushing's, but it can be caused by other things as well. It's a seminar all on its own, but you want to always look for a primary cause, and it can become a chronic condition that can plague your horse for the rest of their days. But we will, in a geriatric horse, do diagnostics for Cushing's syndrome unless there's some other obvious cause. So they broke the opposite leg and they've been standing on one foot for, 2 months and they foundered in that foot. Okay, it's probably not Cushing's. Or they busted out of their stall last night and got into the corn and now they're foundering the following day. So in an older horse, they're more predisposed to it because of Cushing's as well as reduced hoof growth and quality of that hoof. If they're not absorbing nutrients as well, their hoof quality may not be as good. Improper nutrition, other systemic diseases, or just poor hoof care. The management of it is obviously we want to diagnose and treat the primary cause, and then pain management is crucial. NSAIDs or nonsteroidal anti-inflammatories such as Bute, Equiox, or Banamine are probably going to be used. Sometimes we'll use isoxaprine. It will help some cases, not all of them. Cushioning and supporting the feet. I know we got a couple farriers in the room. So I think it's really important to have a good relationship between your farrier and your veterinarian. That team is crucial. Radiographs help the farriers in trimming them appropriately because that coffin bone may not be where it should be. And looking at the outside of the foot, they may not be able to tell where it is and how much sole they've got to play with and how far back they need to bring the toe. So radiographs really help them out. And I think it's well worth the expense to have us there at the same time. Because with digital radiography, we can take x-rays before they start, after they trim it, based on the first set of radiographs, take another radiograph, see if we want to do any more, or stop for that visit. And then we may need to adjust their diet to encourage them to lose weight if they need to, limit their starch, time on pasture. They may need to wear grazing muzzle all summer or live in a dry lot. So as these horses get older, lameness comes into play, especially if they work for a living. Degenerative conditions tend to pile up. It's due to a lifetime of wear and tear, and arthritis is the biggest one. Laminitis as well, or tendon and ligament damage or breakdown. We did mention earlier on that their joints and bones are less resilient to injuries. So there's a whole myriad of things that can be used. I don't think I need to read the whole slide to you, but so we might reach for various different medications or modalities to manage chronic pain, essentially, in these older guys. Tumors become more popular. More popular. I think that's the wrong word. Maybe, more common. So 1 to 3% in the general horse population, but it goes up to 27% in geriatrics. Common tumors beyond pituitary adenomas are this is the tumor that causes Cushing's, and those pesky lipomas are squamous cell carcinomas around their eyes or external genitalia. Pink-skinned horses it's the kiss of tumor. Melanomas, 80%, this is a melanoma in a gray horse. 80% of geriatric gray horses will have melanomas. Lymphosarcoma. Depending on what tumor your horse has, there may or may not be treatment options based on the type of tumor and the stage that we find it at. Respiratory issues, the most common issue is heaves or COPD. It can occur in any age, but it becomes more common as they get older. It's non-infectious lower airway disease or airway inflammation. We usually go with medical management using steroids, either systemically or inhaled, bronchodilators like Ventapolmin, orally or inhaled ones as well. And then antihistamines don't tend to work very well in horses, but it's one that oftentimes gets used as a first line. Want to try something before we go to something more stepped up, or if they're very mild, maybe we'll get a response out of that. But environmental management becomes very important. Getting them out where the ventilation is better, so letting them live outside, maybe in just a lean-to. Don't bed them in straw. Use newspaper or magazines. Might be your turn, Dr. Griffin. Newspaper or shavings. Shavings is a better option. So really just trying to control the dust and allergens that they have in their environment.
What causes that in horses? I know what it causes in humans, but
so it's an allergic reaction usually to something. A lot of times molds in feed, so if they're being fed on a round bale, get rid of the round bale because a lot of them harbor mold. Allergens like hay fever or pollens from various plants, any of that can cause a problem. Cardiac diseases is usually the most common type is degenerative valvular disease. Their valves just start to leak. So this is an acquired murmur. We maybe have been looking at your horse for years and now all of a sudden they have a heart murmur. Many of them are incidental and they're not anything to worry about, but they can lead to congestive heart failure. If you're still riding this horse or your kids are riding this horse or it's being handled by small children, we really do recommend that they be evaluated with an echocardiograph to determine what they are from and whether or not they're a safe option to ride at that point. If you're not riding them and you're just leading them around, that's probably not necessary. But if you're putting your grandkids on them, you might want to think about that. That evaluation, we have a really good cardiologist at the UW. It is relatively inexpensive. It's about right around $300. And there's also an internist that can go from farm to farm and do the same evaluation for about the same money. And then aortocardiac fistula, which carries a very poor prognosis, more common in stallions. They tend to have a heart attack coming off the mares, is what I've been told. I haven't seen one either. Some ophthalmic concerns. Recurrent uveitis is another progressive disease that they've probably been dealing with through their younger years, and the longer they have it, the more likely they are to develop blindness from it. This is a slide of an active case of it with a pool of pus in the front chamber of this horse's eye. Cataract formation. This is a relatively mild cataract versus a mature cataract.
They can remove that cataract.
So that's an age. These cataracts are age-related changes. They may have Cushing's and some insulin issues, so may be linked a little bit like diabetic cataracts in people. It's slowly progressive typically, so their vision impairment comes on slowly. So some owners don't notice it for a long time because the horse is adapting. They're very good at adapting until you leave the wheelbarrow in the wrong spot and they run right into it. So you want to keep their environment static. Don't change things without telling them. There actually was 2 presentations at this year's AEP meeting that talked about hearing loss in foals and aged horses. And anyway, and the causes behind it. In aged horses, it's similar to aged humans in that the cilia in their inner ear become damaged over time. And the cilia are just these little hair-like projections that wave in the fluid in your inner ear and convert sound waves into nerve impulses. So as those get damaged over time, they slowly become more deaf. So there's 3 ways that are pretty rudimentary to check for that. One would be to sit and watch your horse for 30 minutes in a herd setting, because they use their hearing to tell where their herd mates are. And so if as you're watching them, they become startled by horses coming by them, or things, birds that fly by or something, they may have some hearing loss. The one that I wish I had a comic for was clapping behind them. It was suggested that you stand behind them at a safe distance and make some loud noise and see if they jump. Or go around the corner with a grain bucket and have somebody else watching the horse and shake the grain bucket and see if they perk up. Those are all pretty crude, but that's probably the best you got. Or you can do a more scientific approach in a bear test and do a brainstem evoked auditory response, where they put earplugs in the horse and then electrodes under their skin and make noises and test for responses in the skin. They can't tell degree of hearing loss, but they can tell total deafness. And those can be run, if you'd like, at the University of Cincinnati or UC Davis. So there's nothing we can do about it, but we can tell you whether or not they have deafness. All right, Pat, you're up.
All right. I don't know if this is a huge, a lot of you guys here tonight as far as breeding older mares. The reason I asked Lisa about the horse years to human years is because we breed a lot of mares into their 20s. I hate to think we're breeding the equivalent of 65. Yeah,
That's one of the genetics of age.
Yeah, that's kind of weird. So I don't think it's a total rule there. Anyway, how old is too old is a common question we have, because a lot of people do have mares. And again, we do breed a lot of mares into their 20s. I think it really is, you have to take it case by case. And if a mare's had babies previously and is still functioning, good body condition, doesn't have any other health concerns, we're not hesitant to breed them into their early 20s. There is some risk that we'll talk about, but that's kind of there's not a rule of thumb there. more importantly, probably the number of babies that the mare has had is kind of guide us in terms of, I mean, she's been bred yearly since she's a 5-year-old, and she has 14 or 15 babies on the ground, and obviously we might want to back off a little bit because our risk factors really, particularly around the time of foaling, really increase. So generally the mares that we're breeding that are older, and we usually use a cutoff of 15 years as an older mare in terms of how we try to manage them. They're generally high-producing mares, so they've gotten a good track record. A lot of quality babies on the ground as you know, we go into their older years. There are also certain cases that we'll see that a mare, an individual has had her for a number of years, has a big sentimental attachment, they want another one. And so we'll get requests a lot of times to breed some of these older maiden mares that way. And those always, they're a challenge, but we can't do it. What do we deal with these guys? First of all, this time of the year in particular is we start to look at the mares coming into the breeding season, which is the spring. These older mares always come into regular cycles later in the spring than the younger mares do. And that's probably related to some degree of pituitary dysfunction, as Lisa was talking about. So it's important we get these mares under lights and things like that around Thanksgiving time, so kind of speed them up. And we'll go from that. But they do start cycling. Mares don't have a quote-unquote menopause, if you will, where they quit having regular cycles. They do have some age-related changes in the quality of their oocytes, their eggs, if you will, but they continue to cycle really throughout their lifetime. One thing that we deal with from our standpoint, there is some degree of the uterine function, the lining of the uterus and the muscle in the uterus. There are some age-related changes that we have to deal with that are not optimal. There's a higher percentage of these mares that, even though they're cycling normally, and it's always the time that we're breeding them, they have abnormal ovulations if they don't ovulate in a timely fashion. So those are things that we have to deal with, and there's various drugs that we use to kind of cover that up. But left to their own device, many of these mares will have atypical ovulations, is the best way to put it. Certainly, the biggest issue in these mares that are brood mares, we have an increased rate of early embryonic loss, and this is related, much like with women over the age of 35 or 40. There's some degree of change in the eggs, and usually it's chromosomal, and we see this in the mares too. So we have an increased rate of early embryonic loss in these guys. By early embryonic loss, I mean before 20 days or so of pregnancy. So this is something that we're very aware of, and we look at these mares very closely as we go. And certainly related to some of those age-related changes in the uterus, we have an increased rate of fetal loss after 5 or 6 months of pregnancy. And realize in that last 4 months or so of pregnancy, that fetus grows about 75% of its body mass. So once we get to this 5 to 6 month stage, there's a huge demand on that mare's uterus to nourish the fetus. And some of them just can't do that. And so we start to see this time of the year in particular, January, February, into March, a lot of these mares are losing those babies. And it's very disappointing, obviously, but it's something that we see. And we do kind of treat these mares as high-risk mares in that we try to pay attention to them on, usually of every 30 to 45 to every 2 month interval and see what's going on with them. Really importantly on the mares that we breed, I don't have a good slide to show you, but we look at their anatomy behind, underneath their tail head. The perineal conformation changes with age and body condition. So almost uniformly we'll put a castic suture in these guys. I won't go into the details of that, but essentially helps minimize the amount of contamination that's drawn into the uterus through the cervix as these mares are trotting around pasture or as they defecate and urinate. I alluded to the fact that there's a higher risk on these older mares foaling, and it's the rate of dystocia, just having trouble having the baby, is really not age-related. It's an individual thing. But things that we do see are the potential to rupture some of the abdominal structures that support the abdomen. And so it's something that we'll see quite commonly, particularly late in pregnancy. We'll see a lot of these mares that have a great degree of swelling or edema underneath their belly. And it's hard to delineate sometimes what is actually some rupture of those tendons down there and what is just age-related stress on these guys. One thing I don't have on here that we see an increased rate of too is some hemorrhage of the uterine artery after foaling. We'll see that almost uniformly in mares that are over 15 or 16 years of age. So that's another risk factor that we are aware of and we're very cognizant of when we're looking at these mares after foaling. As far as the babies go, one thing we do see with these guys, and that's why nutrition is so important on these older mares, we do see some of the orthopedic issues, contracted tendons, angular limb deformities, those types of things, an increased rate in babies out of mares that are aged. So it's really important to pay attention to nutrition on these guys as they go to minimize that as an issue. As far as the stallions go, though, even if you don't have a stallion yourself, if you're breeding to some stallions, and there are a lot of aged stallions out there that are very popular that have been great stallions, but realize that these stallions, as they age, and we always kind of use that cut for 14 or 15 years, we get some degree of just age-related testicular degeneration. So their semen quality is lower, the numbers of sperm cells that they put out is lower, and it's something to be aware of. Certain breeds are more susceptible to this early on than others. And so it's something to be aware of when you're booking your mare to those guys. They also have some degree of pituitary dysfunction as they age, and of course with all the hormones, there's all this feedback that's going on, and it'll certainly affect their semen quality. Body condition, very similar to an aged gelding or mare. We need to be aware of that type of thing. Importantly, when you're thinking about breeding to an older stallion, though, is there are some seasonal changes. By seasonal, I mean within the breeding season. So from middle of February onto the middle of July or so, we get some changes in semen quality of these guys. Usually it's related to the liquid part of the ejaculate, the seminal plasma. There's some chemical changes that occur over time that we have to be aware of. And because of that, we'll start to see a decrease in semen quality, particularly when we're shipping these semen or using frozen semen from these guys. One thing we also see on these stallions is what we call ampullary plugs, and I'm not going to go into detail on that, but they store a lot of semen. And a lot of these older guys get plugs in their ampulla, so when they ejaculate, they don't put out a lot of sperm cells. And those that they do are not good quality. So it's something that we're aware of. If we're managing these older stallions, we're collecting them regularly, whether they're going to ship semen or breed mares at all. We'll collect them, if we can, 2 or 3 times a week if possible. Certainly the older stallions, in terms of management, they also suffer from some degree of arthritis. Usually hocks and stifles are the ones that bother them in terms of mounting the mares or mounting the fan. So we'll go ahead and treat these guys just like we would an athlete in the sense that we'll get them on Legend or Adequan. We'll oftentimes be injecting their hocks or their stifles to give them some relief. And you would be surprised how much this affects semen quality on these guys, just that chronic pain type of issue that we see. These older guys, as they age, and sometimes we don't have a hint of when it's going to happen, but it often is from one year to the next. So from June one year to February the next year, we'll often see a very dramatic drop-off in the pregnancy rates and their semen quality. This is particularly related to cooler ship semen. So it's something to be really aware of if you're booking your mare to an older stallion. We want to make sure that all the preseason work that we should be starting to do now in the next month or so has been done on that particular stallion in terms of looking at semen quality. Yeah?
Are the breeders mandated to do motility testing at all?
No, not at all. Not at all. And that's an issue. It would be nice if they would, but you kind of got to go by word of mouth.
I'm going to shift gears a little bit and go back towards just management basics for geriatrics. And a lot of these will apply to any age horse. So if you have some older ones and younger ones, you can use the same recommendations. So they need to be observed on a regular basis and get to know their normals. Temperature, respiration, listen to their heart, know what their body condition should be. So if there's a sudden drop, we know about it. Organ failure becomes more common, so a sudden drop in body condition may be an indicator of organ issues, or maybe they cracked a tooth, or one finally got loose enough that it's really bugging them now. Behavior or attitude changes. I alluded to cushingoid horses become more mellow and lethargic. A lot of owners, once we get them on treatment, report within the first month of treatment that they have their old horse back. They've got their young guy back again because that medication really helped perk their attitude back up. Adequate shelter. Dr. Griffin mentioned that stalling some of these is maybe not your best option, but if you need to stall them at night so they've got time to eat away from a aggressive herd mate, that may be, you have to weigh the risks and benefits, or they may be in a run-in shed. A lot of them will do just fine in a run-in shed where they can move around more regularly, or maybe they're stalled during the night and turned out during the day. You may need to consider blanketing them in bad weather if they are a horse that has a hard time holding their weight. We don't want them spending energy trying to stay warm on a bad day, so either stall them for that reason or blanket them. We already touched on the exercise portion of it to maintain their muscle tone and flexibility. Be aware of pecking order issues. The thin horse that I showed you earlier that I saw today was the thinnest horse in the group, and she was living with a Clydesdale, a quarter horse, and another horse that was her age but in much better condition. So it's not always correct, but the assumption would be that she's probably the last one to the round bale. So be aware of that pecking order that they establish, and feed them away from an aggressive horse so they've got time to eat. Feed a high quality diet. Obviously that's something we want to do for any aged horse. And high quality can mean, I should put in there, an appropriate quality for whatever type of horse you're feeding. Adjust their ration to maintain proper body condition. You should be able to feel their ribs but not necessarily see them. Some of these horses that have the abnormal fat distribution, you can still see their ribs, but they still have those fat, crusty areas. It gets a little trickier in those horses, and I'm more willing to let ribs show in them than to keep trying to feed them, especially if we're fighting laminitis in their feet. You may need to feed them on a more frequent basis, so 2 to 3 times a day, especially if they're hard keepers, or if they are having to deal with some aggressive horses. If you're only feeding them once a day, they're probably not getting most of what you're putting out there. And then, as always, free choice water that's accessible and not frozen, and just be aware of the footing around your tanks. Sometimes we let them overflow when we're filling them, and they turn into an ice patch, and the tank looks lovely, but it's surrounded by ice. So groom them regularly, as you probably are anyway, and in that process you can look for lumps and bumps that if we can address them sooner, we may have more treatment options than we would down the road. So a preventative health care, if you want to use the word package that we would consider appropriate, would be an annual physical exam to look for any changing problems. Sometimes us looking your horse over is different than you looking your horse over, because you see them every day and may miss subtle changes that we might notice from visit to visit. Annual to semi-annual oral exams with appropriate dental care. I think over the years we've gotten more aggressive with dentistry. They don't necessarily need their teeth floated every year, but they should be looked at, especially if you've noticed a change in their weight or a change in the way they're chewing, or they're eating slower and slower and slower, or they are willing to eat their hay but they don't want to touch their grain anymore. That may be an indicator that their teeth are bothering them. And they may not have any sharp points at that point, but maybe they've got one that's wiggling when they chew that harder feed stuff. They'll need appropriate deworming that's based on fecal egg counts. I think all the clinics have been talking about strategic deworming that's based on a fecal egg count rather than just a 2-month rotation. As these guys age and their immune systems start to fail, their fecal egg counts may start to creep up. So if your horse has been a low shedder its whole life, and now we're seeing that it's creeping into the moderate or high shedder range, maybe we need to check them for Cushing's disease, or look for another reason why that's happening. Appropriate farrier care, that's for any aged horse. Vaccinations, whether those are annual or semi-annual, goes to what the housing situation for your horse is. If this is a retired show horse that you took out of the show barn and it's now one of 2 horses that live at home and neither one of them go anywhere, annually is probably sufficient for those horses. But if they're still in a setting that's exposing them to respiratory viruses on a frequent basis, then we probably should still be talking about flu rhino, especially in light of that study that showed that they don't respond as well. And maybe even something like strangles or things of that nature. The core vaccines are core for any horse, and those are Eastern, Western, tetanus, West Nile, and rabies. And then you might consider annual blood work or biannual blood work to look for subclinical problems like Cushing's testing or screening, a chemistry panel to look at liver and kidney function, as well as a complete blood count to look for any subclinical infections or anemia. Their nutritional needs do change as things change. If they're a healthy horse, they may be similar to a mature horse with a few exceptions. They may need a slightly increased level of protein in their diet, up to 14% or so. Their phosphorus absorption is depressed a bit, so they tend to need a little bit more phosphorus. The calcium phosphorus ratio that you're shooting for is about 1.5 to 1. Vitamin C and B complex vitamins are something you would consider adding. Most senior diets have these added into them already. And then an omega-3 fatty acid such as soy or flaxseed oils. But whatever health issues your individual horse is having will influence whatever dietary recommendations you may get from your veterinarian. But it should be highly palatable and easy to chew. And if it's not easy to chew, then hopefully it's a pellet that you can make easy to chew. Should contain enough high-quality fiber to aid digestion. Yeah. So it must be in a form that they can actually chew. So just because there's a lot of hay out there doesn't mean they're able to eat it. So they may, if their teeth are in good shape, maybe they can still be on long stem baled hay. Or maybe they're on long stem hay, but they can't eat first crop anymore. They're doing okay on second or third crop that tends to be softer, easier to chew. Or we've had to switch them over to chopped hay or hay cubes that are either dry or moistened, hay pellets, beet pulp. There's a huge number of fiber supplements or fiber substitutions, I should say, that are available for senior horses. These are just 2 examples of senior pellets that are available. But I think every feed company makes a senior pellet these days. They're readily available and they've been a godsend for these old guys. So the topic that nobody wants to talk about is when is it time to say, we've had enough time. There's obviously humane considerations to take into account. Do they have a painful condition? And if so, is it one that can be managed? Is it something that they're going to get over? Or are they likely to recover from whatever's going on? Or is it going to be a chronic situation that they're going to have to deal with for the rest of their time? And if they have such a condition, are you in a position financially or management-wise to be able to treat that condition? So that's certainly something that has to be considered. Obviously, the emotional side of it comes into play, which is why we always ask for you to think about these things before they've colicked, and we're asking that hard question. And just try and plan ahead. And we can help you with the planning of all of this. I mean, this is part of what we do. I think euthanasia is oftentimes the last nice thing you can do for your horse.